Hello everyone. I'm Dr. Sree Bhushan Raju, Professor of Nephrology at Nizam System of Medical Sciences, Panjagutta, Hyderabad, in Telangana. Today I would like to talk to you about chronic kidney disease, which is a very common disease seen in the society. All of you know that the kidneys are the very important and the vital organs in the human body. They are always there 24 by 7 to work, to clean up your body. And everybody requires a lot of cleaning, both externally and internally. And internally, when we do a lot of activities, there'll be a lot of toxins and the poisonous substances which will be released by the body activities that will be cleaned up by the kidney. Initially, the liver will take part in that, and later the kidneys will take over, and it will become more easily clearable, and so that the kidneys can clear the whatever the toxins that are synthesized or manufactured during the day-to-day activities of human body. And both the kidneys are there. Both of them are of equal to that of a fist size, and both of them are located on the back, near adjacent to the spinal cord. And they will be working together, though they are separated physically since birth, but they will work together, and both of them act in a similar fashion. Similarly, these things not only are the simple filters and which can clean up our body, they are also the manufacturers of very important and the vital substances which are required for the human body. And that is, one is called erythropoietin. Erythropoietin is an important substance that is synthesized that takes care of the transport of oxygen across the body and in the form of hemoglobin manufacturing. And the second one is the renin, which takes care of maintaining the blood pressure, and also the vitamin D, which is very, very important substance and the vitamin, and which is naturally provided by the sun rays. But of course, the human body will make it more utilizable to the body, and it will, the kidney, that is the one which takes care of this particular synthesis of active form of vitamin D, which is important for the vitality of the bones as well as the muscles. So hence, kidneys are not just the organs which are there for the filtration, but also are the manufacturers of so many important vital substances which are required by the human body. So chronic kidney disease is a disease which is the one which is the result of the damage to both the kidneys. The chronicity, that by definition, is the one which is irreparable and irreplaceable kidney function. When it is deteriorated, it is called chronic kidney disease. So chronic kidney disease has got several reasons, and every human body is required to work. Both the kidneys are together, but single kidneys also many times it is okay. But unfortunately, some people are born with the structurally abnormal kidneys, and some people are left with unknown reasons. They left with functions of the kidney will be deteriorated over a period of time. This is called chronic kidney disease, either structurally or functionally. When the kidneys are unable to perform their routine activities, it is called chronic kidney disease. By definition, the disease which is lasting for more than 3 months is called chronic. But you can see the disease for several years and years, and this is grouped into 1, 2, 3, 4, 5 stages. But every patient will be staying in each stage for several years, sometimes even decades also. But unfortunately, it is labeled as a disease which is very chronic, and it produces a lot of harm to the body. That's why people are afraid. The treatment is also very, very difficult for many people, and it is expensive and very difficult to manage otherwise. Because of these reasons, the chronic kidney disease is actually an alarming situation, and people are frightened to listen to the term chronic kidney disease. But scientifically, it is not at all a problem, because it can be very managed very easily, and there's a lot of science available to all of us, and there is different modalities and the therapies available to take care of the patients with the kidney disease. All over the world, most important reason, the commonest reason to get chronic kidney disease is the diabetes. You know that the diabetes is the most common cause of kidney failure. Not only that, it is the major disease all over the world, and it is a major pandemic all over the world, and which is there for the past few decades. And as far as India is concerned, we are the number 1 and the diabetic capital in the world, and South India predominantly has got a lot of patients with the type 2 diabetes. Both type 1 diabetes and the type 2 diabetes can lead to chronic kidney disease. But unfortunately, though they are treatable, but they lead ultimately to several complications that includes loss of vision, cardiac disease, brain disease, as well as the chronic kidney disease. And the patients with the chronic kidney disease, when they develop a kidney problem secondary to the diabetes, not only they lose the kidneys, but they lose important vital organs also. It is something like adding fuel to the fire. The uncontrolled diabetes will lead to so many complications, so also the kidney disease. And the patients with the kidney disease secondary to diabetes will do very badly, and they require a lot of care right from the beginning. Unfortunately, though they know that they have diabetes, they don't get screened properly for kidney disease. And we require every patient with the type 2 diabetes should go for a screening for the kidney disease once in 6 months to 8 months, so that they can take care of their kidneys properly, which are very important organs in the body. Similarly, the second most common reason for the development of chronic kidney disease is high blood pressure, which is called as hypertension. Hypertension is a very important cause, and most of the mortality in the world is attributed to hypertension alone. Interesting thing is that hypertension can be detected very easily, and a simple machine that can be kept at home also can really recognize someone having hypertension or not. But unfortunately, it cannot be detected so easily because the people who don't require for the detection because it is asymptomatic. When the symptoms are not there, people will not realize the fact that they have a disease. And the easy part of the treatment of hypertension is that it can be easily treated, and hundreds of drugs are available in the society, and that can be taken very easily. And blood pressure control and monitoring is very, very easy also at individual level. But unfortunately, again, the people won't bother because it is having no manifestations clinically and externally. People won't feel the presence of hypertension unless it is damages some organs. 50% of the mortality in the world today is basically attributed to high blood pressure alone. And hypertension is one of the major causes of chronic kidney disease in the world. And in our country also, 60 to 80% of the general population will be having a high blood pressure, which is not treated properly. 50% of the people who have a hypertension will not be able to feel and will not be detected. Those who are detected, 50% of them will not go to the doctor and they take the treatment properly. And 50% of them who are taking the treatment will not get their BP controlled. And 50% of them will never go to the doctor to get organ damage, either heart or the kidney or the brain, properly in a frequent time. Hence, almost 1 to 2% of the people with high blood pressure only will have a good control and they maintain very well. Unfortunately, this is the disease which is taking away 50% of the world population today every year, leading to a significant amount of mortality as well as the morbidity. But this is very easily recognizable and a treatable entity which should be remembered by every one of us. Then we have so many other diseases which are related to the kidney alone. There are several genetic disorders like autosomal dominant polycystic kidney disease, and which runs in families and which is seen in almost 200 to 400 population, 1 in 200 to 400 people in the country. And though it is genetic disorder, it won't manifest since the childhood. People in 30s and 40s accidentally or incidentally or coincidentally as a part of screening will get detected to have polycystic kidney disease. Usually it manifests in the form of abdominal pain or a backache or sometimes high blood pressure. And whenever somebody is screened and found to have a high polycystic kidney disease, every member of the family should get screened automatically for that. Then only we can recognize a lot of people in the initial stages. Not that a patient with a polycystic kidney disease will have a kidney damage ultimately. Only a few percentage of people only will get damaged. But it is very important and essential for us to screen each and everyone who has got a chronic polycystic kidney disease in their family members. And the genetic tests also can be done, though expensive, not available everywhere. Polycystic kidney disease should be recognized very in the early stages so that we can manage them very well. Almost nearly 80 to 90% of those people will get a kidney damage by the time they reach 55 to 60 years of age group. If we take care of them properly, it can be postponed and it can be totally prevented also. Hence, screening for all the family members is very essential. We have certain diseases which are related only to the kidney per se, which is unrelated to the entire body, like glomerular diseases and tubular interstitial diseases. Glomerular diseases, as you know, that the glomerulus is the filtering unit and the filtering agent within the kidney. And whenever it gets damaged by the unique disorders which are unique to the filters, this is called glomerular diseases. The glomeruli are fitted into the environment called tubules and interstitium. The tubules are the ones which carry the urine which is being filtered by the glomeruli, and ultimately they come out of the kidney in the form of urine. And when the filters are damaged, it is glomerular disease. When the tubules which are carrying the urine are damaged, it is called tubules. And when the surrounding environment is called damaged, it is called interstitial damage. So tubules and interstitial damage, they go hand in hand, hence called tubular interstitial diseases. So glomerular diseases and the tubular interstitial disorders are the major causes in an individual. If you really take something called IgA nephropathy or focal segmental glomerular sclerosis or membranous nephropathy and so on and so forth. So these kind of disorders are related to the kidney per se, and they damage the kidney gradually over a period of time. Compared to the glomerular diseases, the tubular interstitial disorders grow very slowly and gradually over a period of years and the decades. But hence, though it is important for us to have a disease which is very slowly progressive, but it can simultaneously damage the body very slowly and unknowingly and covertly. So because of that, they need to go for the doctor, follow up regularly, and they get treated properly so that the toxins should not damage the human body ultimately. It's very, very important for us. So glomerular disease, on the contrary, they rapidly deteriorate. and they become symptomatic very early. These are the people, they come to us with a lot of symptoms like swelling of the body, face, etc. And they get into high blood pressure also at the same time. They'll be leaking a lot of protein in the urine. Then we investigated. And they have to go for the kidney biopsy, which is an important investigation modality to know the diagnosis of the disease. And ultimately, tubular interstitial disorders also will slowly, gradually lead to kidney failure one day or the other. So other than these two disorders, we have so many other conditions which can lead to kidney disease. Something like the drugs, you know that we'll be taking a lot of painkillers, antibiotics, antacids day in and day out, either prescribed by the doctor or over the counter. So because of that, the kidneys will get damaged. We need to prevent this particular entity, and we should not get into any such kind of a phenomenon where the people take a lot of drugs and the kidneys are damaged. There should be some restraint by the physicians also in writing prescription to the patients who are innocent and illiterate. And at the same time, we have so many other conditions like infections and major conditions like tuberculosis and infections related to the kidneys per se, like chronic pyelonephritis, and these are the things which can lead to kidney damage. There are several other minor entities also, both genetic and non-genetic disorders which can lead to kidney disease. The interesting part is that kidney disease doesn't have any major manifestations in the initial phases, and over a period of time, they slowly and gradually develop. And we can consider that the swelling of the feet and the swelling of the face initially are the major manifestations of the kidney disease. But over a period of time, slowly they develop other features also. When the kidneys are damaged significantly because of the chronic kidney disease, they develop the loss of appetite, weight, and also difficulty in breathing and loss of interest in the surroundings. They'll get weak and they lose the muscle and they feel very bad and sick. But this is the final stage of the kidney failure. Initially, the screening only can really detect all the people. Unfortunately, manifestations externally are not there. That is the reason why many people don't believe that they have a kidney disease. And many people, they routinely think that the low backache and other things are related to the kidney. The kidneys are situated in the upper part of the back, but not really in the lower part. But whenever they get a back pain, they go and seek attention of the doctor. But that should not be a problem. Many times we can screen the people into some kind of a disease. And so many people think that the kidney stones are there because of the backache. But the stones are also major cause of kidney failure in our country, and the stones are also easily treatable and preventable conditions in our country. And any screening is very, very important so that we can detect the disease very early and treat them efficiently. Screening is also very easy. It's not a major disease where cardiac disease, where angiograms and bigger investigations are required. But detecting the kidney disease is very simple and easier. We can have a simple investigation called complete urine examination, where you can see the leak of protein as well as the red blood cells and the WBC in the urine. And we have a blood test called blood urea and serum creatinine. Whenever they are elevated beyond their limit, and that is indirectly a marker of kidney dysfunction, sometimes it can be temporary, sometimes it can be permanent, and it all depends on the clinical history the doctor is supposed to take properly and explain to them. And we have another important investigation modality called ultrasound examination. In the ultrasound, you can see the kidney size. The kidney size of more than 9 centimeters is approximately good for an Indian body. But whenever it is less than that, less than 9 centimeters, usually it indicates a kidney damage, or it can be a small kidney that should be further investigated. So these are the simple tests that can be done to know whether through investigations we have a kidney disease or not. But it is available, though it is available across the country in major parts of the cities and the towns, even small villages also. Unfortunately, many people do not go for the kidney screening routinely. So hence we attribute some of the patients, we request them and we advise them to go for a screening regularly. These are the people who are having either hypertension, diabetes, people who are obese, people who have been who have been into smoking and alcoholism, people who have a family history of kidney disease. That is, the parents, siblings, children are blood-related people who are having a kidney disease. Their family members also should be screened. People who are having a long-standing joint and muscle disorders, people who are having a skin disorders for a long time, people who have been taking a lot of drug therapies for various clinical conditions, including the cancer therapies and all, people who are having a heart disease or a brain disease for any other reason, something like a heart attack or the stroke, they're all the people who require regular screening for the chronic disease. And once they are screened, they should be referring to a nephrologist and who will be treating them with the proper, appropriate conservative treatment. But the conservative treatment is important for many people. And not that everybody requires dialysis only straight away. Conservative treatment can be given for several years, even sometimes to 2 to 3 decades also. People will be doing very well. But only part is that they should be able to take care of their physical activity properly. Dietary therapies are very important. Simultaneously, control of the sugars and the BP is also important. And more important is the drug therapies, which are there to control the bad effect of toxins on the human body. Ultimately, it is more important is to preserve the human body, which is very important and essential to withstand the disease. So we can inhibit the negative aspects of the disease by taking good conservative treatment. I mean, whenever the conservative treatment fails, that is called something like going across the stages of kidney disease called 1, 2, 3, 4, 5. At the end of the fifth stage, where we have a CKD stage 5D, where the dialysis requirement is essential and paramount. So here we initiate the patients on dialysis. But not that at once we start the patients on dialysis. Initially, we have to prepare them properly. During the preparation, not only we see that their blood pressure is adequately controlled, sugar is adequately controlled, and they will be vaccinated. There is something called AV fistula, which is called arteriovenous fistula, which will be done on the hand so that they can go for hemodialysis properly. And after that, once we initiate the hemodialysis, invariably the patient with a chronic kidney disease who progressed to end-stage renal disease, they would require a dialysis every alternate day, that is 3 times a week, they should go for a dialysis. And the dialysis are very important and essential component of the management, and they should go for a twice-a-week dialysis regularly. And we have one more modality called peritoneal dialysis, where a small tube will be put into the abdomen, which is called stomach below the umbilicus, and through which they can send fluid, especially formed fluid, and it will be there for a few hours, then they can drain it out. This is called peritoneal dialysis. This can be done at home comfortably. For hemodialysis, the patients have to go to the hospital, but peritoneal dialysis can be done at home. Other than these two modalities, the most important aspect of management for the kidney failure patient is transplantation. Kidney transplantation is very, very important and essential. It gives a wonderful life to the people of kidney failure. So ultimately, we have wonderful science and so many good therapies are available to take care of the patients throughout their life to see that the kidney functions very well after the transplantation. So people have to believe in the science. Science is there to look after them, not to get discouraged, not to get disheartened by listening to the term chronic kidney disease or the kidney failure. Though the term kidney failure is very frightening, but it's not a failure. Failure also can be a successful story at the end of the day, provided you should have the thinking and the right correct attitude and appropriate thinking process so that you can need a good therapy by a good nephrologist. Thank you all.